Prepare start to start sharing. Wonderful, here we are. Today's topic is scaling safe food delivery during and post COVID-19. My name is Allison Kuntz, the Elders Department Director. I'm with Samish Indian Nation in Anacortes, Washington. Samish Indian Nation is located on the Salish Sea in the northwest corner of Washington State. Today's learning objectives are discuss how to expand culturally accessible services to older adults and families during a pandemic, share best practices to provide vulnerable seniors with nutritional support at home during and post-pandemic. I just want to give you a little overview of our program. The Older Americans Act Title VI funding provides nutrition, supportive services, and caregiver support services to American Indian, Alaska Native, and Native Hawaiian programs. For us here at Samish, we consider our Samish citizens to be an elder at the age of 45. American Indian, Alaska Natives can also receive services through our program. Our service area is 4 counties with a mix of urban and rural areas. Before the COVID-19 pandemic, the elders and caregivers met 5 days a week at our Elders Center. During the 5 days, the elders would come together for a meal. Throughout this time, staff would provide nutrition talks, information, and handouts. In addition, as needed, we offered confidential nutrition counseling. Meeting in person at the Elders Center provided an opportunity for the elders and caregivers to experience social engagement. They saw their friends and they met new friends. Also, the staff was able to give the elders and the caregivers face-to-face interactions and foster trusting relationships with them. This time together helped provide a listening ear and determine how to meet the needs by offering information, referrals, assistance, and resources. Overall, encountering an in-person connection helped support the participants' emotional and mental well-being. Once a week, a nurse would meet individually with each one of our health and wellness and do health and wellness checks. The elders and the caregivers benefited from this time of interaction. The big highlight of the week was Wednesday's Beading and Crafting Day. On the other days, we would offer activity classes, cultural events, and practical educational classes. All of these in-person program services mentioned were put on pause at the start of the COVID-19 pandemic and shifted to a different way of supplying the much needed services to our elders and our caregivers. Now, I'm going to talk a little bit now about navigating our program services during COVID-19 pandemic. So since meeting in person during the pandemic was impossible, we needed to look for ways to provide the essential services, to engage our elders with enrichment activities and keep them connected. So we needed to implement the following program services with some creativity to keep the elders, caregivers, and staff safe and healthy during the COVID-19 pandemic. The main highlighted programs are our nutrition program shifted to home delivery of meals and grocery bags. We were able to send out food boxes, personal health care items, cleaning supplies, and PPE, personal protective equipment. Information, referral, assistance, and resources were done through phone calls, in-person visits, and information packets. Our Richmond activities became virtual online through Microsoft Teams. So we met virtually for gatherings, for cultural and topic talks, and of course, bingo, which they truly loved joining up for that. And the last area that I will talk about, a program that we put into place, is called the Hello Friend Project. So we'll go ahead and get started with the nutrition program. Home delivery of frozen meals and grocery bags. So we experienced an expansion of meeting nutrition needs due to the home delivery. We served more elders and caregivers rather than meeting in person for congregate meals. I really believe that this had to do with the rural area that we live in and the elders and caregivers not being able to come together for congregate meals at our elders center. Home deliveries just worked out better. To join the delivery program, our team gathered much needed information about each participant, especially their food allergies. Another addition to our nutrition program has always been traditional foods. For example, stinging nettles were harvested and prepared as cooking ingredients for elders' meals and tea. Pictured is the tea gathered and dried for the elders, and that's the stinging nettle tea. We also harvested Labrador for tea. The elders enjoyed a mixed variety of freshly harvested certified organic produce and native grown foods from Long Herring Farm throughout the summer into early fall. Long Herring Farm is Indigenous owned and integrates growing Indigenous seeds and practices. Also, I'd like to share that we truly welcome a substantial gift of salmon caught by our neighboring tribe, Upper Skagit, and was then donated to a local food bank for them to freeze and distribute. The local food bank reached out to the tribes and they wanted to give the salmon back to the local tribes because of the ancestral land of the tribe and the deep and powerful connections that we have with our homelands. Everyone's very thankful to receive the generosity of the gift. The Muckleshoot tribe generously donated 400 pounds of frozen food. We use the food in preparing meals as well as including food items in the grocery bags. And the donation of the 400 pounds was mainly seafood. So during the COVID and even not during COVID-19, gardening is always an excellent activity for elders to contribute to their support of healthy eating, physical activity, and well-being. I think we all saw a shift in everyone getting into gardening, growing their own vegetables and their own food. And so we got on board with that with our elders. So to help the elders have this kind of experience, we offered various organic vegetable starts, seeds, herbs, and natural and chemical-free soil. We provided extra soil, garden assistance for the elders who needed garden assistance and watering of their buckets of produce or vegetables. And this took place during the growing season. And so we were really happy to have a significant part in giving the elders a rewarding connection to nature and seeing their gardens transform. We are very thankful for our food service team who led this up in creating and implementing this beneficial program for all who were involved. The grocery shopping bags included a mix of fresh, refrigerated, frozen, and canned items. So shown in the picture is an example of a delivery of bagged items. We kept the refrigerated and frozen items in a cooler when they were transported to overcome the barrier of social distancing and not entering the home. We purchased utility shopping carts. Pictured, you'll see the cart there. On delivery day, the participants who were receiving the items would place the cart on the doorstep for the drivers to fill up. And the carts worked out well for them to be able to transport their items to their kitchen and to help them actually not to do a lot of heavy lifting. When the drivers came to the Elder Center to actually pick up the deliveries, we requested that all staff, actually, as we entered our buildings here at Samish, we had to wear a mask, do hand sanitizing, and then we needed to fill out our little sign-in sheet. And then when you left the building, you had to sign out. And that was good for tracking who was coming and going throughout the day. So another aspect of the nutrition program during the COVID-19 pandemic was the coordination of the deliveries. The program participants who lived nearby, but some of them lived as far as a 2-hour round trip in rural areas. So we needed to schedule deliveries by area to manage the driving time and coordinate all the deliveries. Phone calls went out the day before the delivery as reminders to have them put their carts out on their doorstep. And in May 2020, at the beginning of the pandemic, we had learned from another tribe the idea of using green and red colors to let people know how they're doing as they pass by a home. And we used this helpful idea by laminating 2 pieces of construction paper back to back. And then we instructed our elders and caregivers that on delivery day to please place the sign in the window. Green would be for you're doing good and everything is well. And then red would be if you need assistance. And then we would know right away to call in to the elder. We would know that we were alerted. We'd have other contact information if we needed to reach out to the elder's family or friends. To keep everyone safe and healthy, we instructed the drivers to put on a mask when they arrive at the homes before leaving their vehicles to drop off the items. We instructed them for frequent use of hand sanitizing and hand washing, and this became routine for them. When test kits became readily available, we had drivers test for COVID if they were not feeling well and had symptoms. And again, all Samish staff, we were instructed to stay at home and isolate if we were not feeling well or were ill. We asked our program participants to keep us posted if they had symptoms of not feeling well and to have them let us know about what was going on, because at that point, we would determine if and when the delivery could happen. Again, all Samish staff and even the temporary help that we received from staffing agencies are required and still are required to be COVID-19 vaccinated. So next, I'm going to talk a little bit about our food boxes, personal healthcare items, cleaning supplies, and PPE. Local agencies, tribal and non-tribal, were really great about extending a hand of support to help in a time of need during COVID-19. Items received were donated, and it was food boxes, personal healthcare items, cleaning supplies, and PPE. These essential items were well received by many. With weekly deliveries, we could stay in touch with our elders and caregivers via the phone frequently. We use this time to remind them of their upcoming delivery, see what else they may need, and visit with them. In addition, we would do wellness checks over the phone. Our drivers were able to have in-person visits standing outside with masks on. The drivers took some time and asked how the elder or the caregiver was doing and how we could help. They brought this information back to the department, and we could follow up with information, assistance, or resources to meet the elder and caregivers' needs. Having an in-person check-in was beneficial to see and understand how they were doing visually. In each participant's grocery bag, we would place an information packet or activity kits. And I'm just going to go ahead and give you some ideas of these information packet and activity kits that we sent out. We sent out recipes specifically for grocery assortment that they would be receiving that day, along with nutrition and healthy food handouts. Our farmers market had vouchers, and so we sent out information on that and how they could get their farmer market vouchers for fresh produce. We had some really hot summers here in Washington, and helping to really encourage our elders to drink water and stay hydrated was really important. That we also included the Brita water filter pitchers and extra filters, so that would encourage them to stay hydrated. And of course, always we send out CDC guidance information pertaining to COVID-19, our local county information, so they would truly be in know of what's going on. With them being in the house all the time and being isolated, we sent out Falls awareness handout and night lights. October was fire prevention, so we send out a handout on fire prevention with smoke detectors and batteries. And we were very thankful for the Northwest Justice Project. They held a power of attorney and healthcare directive clinic via phone or a video chat for our elders and caregivers who needed the services. And then, of course, we sent out fraud prevention handouts. Some of our activity kit packets, some were really more about culture, and others were just for fun. The Samish Library was able to send out an inventory list on how to check out books and videos. We provided the librarian's contact information, and our delivery team actually then became like our mail carriers. So they were able to deliver the books and videos to the homes, and then of course pick them up and take them back. So we had a good routine going with our library. We also sent out our language department activity books so they could continue to be in touch with the Samish language, and maybe for those who didn't speak the language, they could be familiar and learn about the Samish language. We created cultural crafting kits. We sent out Salish Coast art coloring books with colored pencils. We even created an at-home wellness bingo game with surprise giveaways when they sent the filled out card back with the delivery driver, and then we would send out the little fun surprise giveaway for them to complete their bingo card with the delivery driver. And some examples on the bingo card were pretty basic, but I think it really meant a lot. You know, just to go sit outside, you know, if they went for a walk or even called a family or a friend, just to try to give them some type of social, to get away from social isolation and to be able to do this bingo game was a good activity for them. Plus, there's much more, but I'm going to continue on here. I want to talk about our Richmond activities and events, that how we had to move to a virtual platform online. Meeting and gathering quarterly online still continues to be well received. An online platform in Microsoft Teams allows more elders to participate across the miles. We do have Samish citizens, not only locally, but nationally and internationally. And within that international, that includes our neighbors, Canada to the north. We are excited to see many of our elders attending who do not live near the tribal homeland. Elders have good conversations and participate in cultural talks, traditional singing and drumming, and bingo for prizes. In addition, we set aside time for elders to share a photograph and tell the story about the photo. During the sharing time that the elders had, they could talk about a family celebration or a family accomplishment, or even a happy moment in their life. And this part of the gathering is actually their favorite, since it really adds a personal touch and connection with each other. So also during these events, we included giveaways with handmade items by our elders. I'm going to talk a little bit about our culture and topic talks. During our quarterly virtual gatherings, we had a time of cultural sharing and providing information. Here's about 2 or 3 of our cultural talks that we shared about. We had one of our elders share gifts from our hands. They talked about the Samish culture and how it relates to our traditional crafts, and she had a wonderful photos to share with that. Traditional food talks, the elders love that, and those are very popular. And then during one of our spring gatherings, we had a Samish cultural approach to spring topic, the moon of the frog. Some of the topic talks that we had during our online gathering with the elders, of course, was always health information, always the updates on COVID-19, the happenings and vaccinations, the importance of flu and shingle vaccinations, you know, falls awareness for some examples in the health information. And since the elders just love our library here at Samish, we did a virtual library tour and showed it online, and a book talk, and that was very popular. I do also want to share the fact that our tribal council was very supportive of, as always, has the best interests in mind for our elders, but they were would always be part of our elders gathering. Our chairman would come on in the beginning and do the welcome and just to reassure the elders that, everything's going to be okay, and just give really updated news in regards to the pandemic. We would have bingo fun. Now, due to the popularity of the quarterly online gatherings with bingo, we now offer a bingo only event, and this is fast paced, 1 hour of bingo. And we also do fun jokes. So it's a good time is had by all during bingo fun. Just want to show briefly here some of the items. First, the picture on the left, the handmade beaded items by our elders. We have some earrings, keychains, and then a mask holder. One of our elders came up with the idea to bead a little mask holder, and that was a very popular gift to give to everyone. It's quite practical too. Handmade crocheted items by elders, of course, a little quarter bag, some pot holders and coasters. The weaving of a handmade small basket necklace. And then we would have other items that we would purchase, and we try to do them as close as possible cultural in native arts, mugs and ornaments here. And that, especially the mugs, the elders love the mugs. Continuing on, the last of the program that I want to talk about that was put into place during the COVID-19 pandemic is the Hello Friend Project. We are always interested in putting into place programs and activities the elders would enjoy and would like to have a participating role. But trying to start a new activity during uncharted areas of a pandemic and not meeting in person was challenging. The Hello Friend Project was created to give elder engagement opportunities with interactions across generations while being isolated at home. The project provides the elders and children with a fun and engaging way to experience generational friendships. So first of all, the Hello Friend projects like having a pen pal. Of course, the children at our Head Start and Learning Center are quite young, so they're not reading or writing yet, but they sure can craft and make cards and do coloring sheets and drawings. So the elders and the children ended up doing an exchange of this. So we found that both groups really enjoyed contributing to this activity, to use their gifts and talents to share their creativity. So we used our food delivery program as our mail carrier to deliver the Hello Friend items to the homes. This worked out very well because the elders were not meeting in person. They were isolated at home. And at one time, the children were not attending classes on site. But it worked out really well for me just to call up the elders and let them know that this is a craft idea. We'll go ahead and send out these items. And so we sent them out through our delivery program. They completed these items at home and then sent them back to me. And then I was able to get them out to the school for the children. So what had happened that I had found that during the pandemic, some of the elders didn't really lost the desire to craft or to really, be involved and to participate. And so that was really surprising for me, since the elders are really a crafting bunch. And so this program really helped the elders to give them a little bit more spark of wanting to have more interest and just really getting them back into crafting. We hear very heartwarming responses from the children when they receive a craft from the elders. And this is my favorite response. is one child said, "The grandma made this for me." So the children love to receive their surprises from the elders. And again, we are looking forward to the fun of gathering in person and creating as a group. So now we're coming to navigating program services during post-pandemic, and I'll just share where we are right now. So with the federal COVID-19 public health emergency declaration ending on May 11th, we opened up our Elders Center on May 11th for congregate meals. We have seen that the elders and caregivers are slowly coming back to join us. Before starting back up, I had sent out a survey asking the elders and caregivers just to double check with them again about their food allergies or food items that would be their least favorite and they really don't eat. And then within that survey, I offered a checklist of main dishes, fruit and vegetables that they would like to see, would like to eat and enjoy at our congregate meals. A little bit about our events and classes. So effective in April, we slowly started having some of our elders attend, gave them the option to attend in person while we literally had our events being held virtually. So we're currently doing virtual and in-person for our events, and even for Samish Indian Nation as a whole, our cultural department hosts virtual and in-person. We will never get away from virtual events or classes here at Samish because of our Samish citizens being locally, nationwide, and internationally. We're able to see more involvement from our Samish citizens when they're able to hop on virtually for an event or a class. Coming up on June 23rd, we're hosting our neighboring tribes annual Samish Elders Luncheon to honor our elders. And this will be the first time that we're gathering with our neighboring tribes since 2019. Going forward, survey of programs. I know within this presentation, I highlighted programs that we offered before, programs during the pandemic, but now I want to send out another survey to the elders and to ask them the type of activities, events, educational classes, or field trips that they would like to be involved in, just to really give them the opportunity to have a voice at the table, to share of what they would like to see as we're post-pandemic during this time, and what they would enjoy. So this concludes my presentation, and if you have any questions, I'll do my best to answer them.
Thank you, Miss Allison. Thank you for the wonderful presentation. It was wonderful to learn. This is the time for questions and answers. So if you have any questions, if you don't wish to speak, you can put them in the chat and I will speak for you. Or if you want to raise your hand and come off mute and ask questions. Okay. Well, I do have a couple of questions myself.
Oh, okay.
Since COVID can live on surfaces for extended periods of time, what did you deliver, the food in? specifically, so that, the transmission um the transmission risk was minimized. Could you go over that again?
Uh, so we, so the frozen refrigerated items were always placed in a disinfected cooler. And we made sure that was totally disinfected. In preparing the bags, we would wear gloves to reduce transmission. We would have our masks on. We would then also, to reduce the transmission, I think, of having the face-to-face with the elders, we would place those bags out in their carts, and then they would decide at that time. I know some people were setting aside items that, or packaging for a number of days, but we just did the best job possible, because it was very important also to get food out to the elders during that time.
Anyone else have a question? Otherwise, I'll ask another question because I had a lot of questions. Okay. Well, my next question. What was the risk of food being delivered to the home, in terms of not only just COVID transmission, but, food spoilage potentially, or, allergies, stuff like that?
So in our intake form, when our elders and caregivers were interested in being part of the elders food delivery program, we would do an intake, and we would get their food allergies. We also, one thing I didn't mention is cleaning supplies, especially for the sensitivity of allergies of cleaning supplies. Though a lot of the donations of cleaning supplies wasn't necessarily the cleaning supply types that the elders use. They might have used like no dyes, no hyperallergenic, types of cleaning supplies, and very natural cleaning supplies. So we would substitute in order to meet their needs in that way. So allergies overall, the food and the cleaning supplies. And then as far as getting their preferences, we wanted to send out food that the elders would eat and the elders weren't allergic to. So that prevented spoilage. We make sure that we watch the expiration dates when we sent out the food, and with calling ahead to letting the elders know that we were coming out with the food. And we also gave them a time frame, and the timing of our deliveries and our areas that we delivered to with our drivers. We were able to do a pretty quick turnaround so there wouldn't be spoilage.
Anyone else have a question? Okay. Well then I guess my last question, kind of going back to like the risk of food being delivered, but more so, did you offer training to the drivers or the staff, like when they're how to prepare food, how to package food, dispose of food, washing hands? Did you offer that down to the drivers? But when you're doing washing hands, did you offer that to the people that you were serving?
Yes, that was a priority for us. So we kept everyone safe during the pandemic. And we did have the training was spent at also as reminders to the drivers, even before they went out, because they knew the guidelines, but we'd also give reminders. And one thing I forgot to mention, they always carried a cell phone with them. So we were always in contact with them, and then they were always able, when they pulled up to the driveway, to call into the house to let them know that they had arrived. So yes, definitely a lot of how to to do this, and it really kept, it was very important. It put in really great safety measures to keep everyone safe.
Well, thank you. Could you also put your email address in the chat box for people if they wish to reach out later?
Yes, I can do that. Thank you.
Well, if there's no other questions, I just want to say thank you to everyone who attended this environmental health series session. In the chat, also from me, if you'll see, there's an evaluation where we just want to get your feedback, and it's very valuable to us. It's very appreciated, and we use that information to improve. And we also consider suggestions for future trainings if necessary. The next session will be Wednesday, June 28th, in the Environmental Health Webinar Series. And NHB will be hosting our first Environmental Health Summit, July 25th and 26th in Oklahoma City. So save the dates. With recordings and presentation slides will also be attached to the email that will come out later at a time. But if there's no questions, there's no concerns, thank you for coming and have a great evening.